My name is Stephanie Reinhardt, and I am the Prevention Program Manager at the Kansas Department of Aging and Disabilities. At Kansas Department of Aging and Disabilities, we are responsible for the prevention services for the state of Kansas. In Kansas, our mission is partnering to promote prevention, treatment, and recovery to ensure Kansans with behavioral health needs are safe, and they live safe, healthy, successful, and self-determined lives in their communities. The way that we do this is partnering with the Kansas Prevention Collaborative. They are an integral part of prevention services across the state. They promote the partnership with communities and coalitions around the state of Kansas, ensuring that their voice is heard as it relates to prevention needs in their community.
My name is Deane Armstrong, and I'm a community sports specialist and training consultant at DECA. DECA's main role is to provide training and technical assistance to coalitions and communities throughout the whole state of Kansas. If a community doesn't have a coalition and they're interested, we can help them to develop that.
Sure, our role is that we are partners. We're evaluation partners with Greenbush, and so we're at KU Center for Community Health and Development, and we provide the online documentation system where communities and actually contractors enter accomplishments that are data, end up being data, and we evaluate that data and provide reports at the community, state, and federal levels.
I am with Headquarters Counseling Center. First of all, we are involved in the steering committee, which helps to plan the Prevention Works meetings that happen quarterly. And our role is to provide a suicide prevention voice and really have that perspective join with other prevention perspectives. So it can be kind of looked at as a whole prevention effort.
Lisa Chaney, I'm Director of Research at Greenbush, the Southeast Kansas Education Service Center. Greenbush administers the Kansas Communities That Care student survey, and that survey provides valuable information for school districts and communities and for the state on students' behavior and perspectives and attitudes. And then this data is used for our coalitions across the state for assessing the needs at their local level to see what they need to prioritize and the risk factors that are driving problem behaviors in youth. So they use this data for needs assessment. And then they also use the data once they've identified strategies to address the need. They use that data to help monitor progress they're making towards their goals, so for evaluation.
My name is Chad Childs, and I'm the Prevention Systems Project Coordinator with Wichita State University's Community Engagement Institute Prevention Initiatives. And our main role is communication and connection. Part of our purpose is that there's so much great stuff going on in prevention in the state of Kansas, and there are opportunities for us to share that story in a broader way so that the whole state is aware of what people are doing.
I'm Heather Winkelfleck, and I am with WSU at the Community Engagement Institute, and I'm part of the Prevention Collaborative on the training team. And what the training team's goal was to make resources, trainings, different types of materials that would make the grant process easy and provide those resources so that they would be very effective in how they implemented the strategic prevention framework.
My name is Crystal Dalmasso, and I'm a community support specialist for South Central Kansas with DECA.
One of the ways that we serve as the communication hub for the Kansas Prevention Collaborative is with Prevention Works, and it's an opportunity to get coalition representatives together from across the state to learn from each other and to share their ideas. Prevention Works has expanded to where now we have, on average, around 40 people attending a Prevention Works meeting every quarter of the year, and it's a good opportunity to welcome new people that haven't done a lot of work in prevention and don't know much about prevention science or substance abuse prevention, to get them involved in substance abuse prevention strategies and coalitions in their area, including focus on preventing problem gambling and suicide and other behavioral health concerns. Prevention Talks is another strategy that we use with the Kansas Prevention Collaborative to help people share their stories and share their experience with prevention in a way that can help other people learn from their experience. Prevention Talks started off as a webinar that was scheduled monthly, and it seemed to be serving its purpose for a small audience, but it wasn't getting the audience and the reach that we had hoped it would get. So we moved from a webinar, a recorded webinar and live webinar, to a podcast format, and that really helped increase engagement. I think it was something like a 500% increase in listenership from the previous webinar to the new podcast format. We send messages through email to our contact lists that have representatives from coalitions and representatives from the public that have signed up to get our information. And so we share stories there about what people are doing in the state for prevention. We also share funding opportunities like grants that they might consider applying for to continue their prevention work. We share information about other things that are related to prevention, like the newsletter contains information that includes some sharing of information about community coalitions activities. The second annual Kansas Prevention Conference took place in Wichita, October 1st through 3rd, and we had around 200 attendees come. The purpose of the conference is to raise awareness about substance abuse, problem gambling, and suicide prevention, and to promote the great work being done across the state, while also providing more people with more resources to make positive change last. A highlight of this year's conference was the people there, including our speakers like Lieutenant Governor Lynn Rogers, Dr. Dennis Embry, Ricardo Harris, our presenters from all across the state with a lot of expertise, and also all of the great and passionate people that attended. Because the theme was community focused and future minded, we were able to include the youth and had a lot of youth attend to learn more about prevention and what we're doing across the state, and also to have the youth teach us and teach the adults in other communities about what they've been doing and in their communities. The way that we were able to do that, for which we're really appreciative, is Blue Cross Blue Shield offered a substantial donation to help cover the cost of registration and lodging and travel for many of the youth to attend. So definitely want to give a good public thank you to Blue Cross Blue Shield for helping support the conference and being even more future-minded.
At DECA, our prevention services engages with over 1,500 community connections each year. We provide a variety of assistance and trainings. We have e-learning modules on the KPC website. They can be accessed there and on our DECA website, and we have toolkits that can also be accessed. The e-learning modules and toolkits are on a variety of topics like substance abuse prevention and also the strategic prevention framework. And those e-learning modules have been accessed almost 1,300 times just this year. The great thing about our toolkits is they can also be accessed in both English and Spanish. So that's a great thing that we've got accomplished this year. And our toolkits have been accessed almost 900 times this year. So they're being utilized by community coalitions. So we work with about 300 community coalitions, partners, individuals working within prevention in Kansas communities all across the state.
We had 12 trainings last year. Of those 12 trainings, we had over 260 participants, which is really exciting because when you think about the process of the SPIF-SIG and the different deliverables and materials that can help them ensure their success, there's a lot of behind-the-scenes work that has to be accomplished, and those trainings really offer them some supports and the likelihood that they're going to be able to sustain the process long-term, way past the funding of what they receive from KDADS. Those trainings began with orientation. Then after orientation, we had the SAPS training. Then after that, we have what is called the assessment and capacity training. A couple of months later, we bring them back and we work with them very specifically on that of planning and implementation and finding those evidence-based strategies to implement within their communities. We have also what is called our evaluation and data workshop. Through the entire year, they are also receiving trainings through the community toolbox, and that is documenting what they're doing within their communities. One of the final trainings that is offered is that of the community's opportunity to share through the sense making as far as what their data is telling them and what they've been offering within their communities and just that impact that they're having within their communities.
Another strategy that we've been using in our role as the communication hub is the website and the KansasPreventionCollaborative.org website and social media. In the past year, we expanded from only Facebook to Twitter, and we have plans and hopes to expand beyond that in the future. The Kansas Prevention Collaborative Facebook page also maintained some steady growth through the year, and we had interest from several different countries as well, and over 177,000 people saw content from the Facebook page during the year. That averages out to right around 480 people per day. So that was another exciting thing to think about, is that our Facebook page, social media, was reaching a lot of people every day, more people that could get engaged. We had a single post in April that reached 68,251 people. The website reached people speaking 55 languages, and we had people visiting our website from over 100 different countries. And we had over 31,000 page views in last state fiscal year, which is really exciting because that number just continues to increase and grow, and so that means that we're reaching more and more people.
A couple of my colleagues and I went and we provided some assistance and some training for one of our local coalitions here, and we walked them through some training on logic model, and we really dug into the local data, and they took what they learned during that training back to their community coalition, and they used what they've learned, and they began to then build the next steps of what they're going to do within their community, and took that, and now they're doing even more prevention work than what they initially thought that they were going to do. And they see then the numbers of youth use, that 30-day youth use and alcohol use really decrease. And so it's really exciting to see what the trainings that they're attending, they're taking that knowledge back and they're really able then to use it within their communities.
And it's so exciting and rewarding to work with coalitions, building those relationships with new communities. I have new coalitions that have been built. I know that I have a few that will be applying for planning grants next year. So I'm excited about that. I think the more knowledge that communities learn about effective prevention work and using evidence-based strategies, the more effective they'll be for community change that'll be long-term, which the main goal is to make their communities a safer and healthier place for people, citizens to thrive in. And I think that our work helps them with that. So the more that we have communities that have coalitions that are doing effective work, we also really have a vision for integration. We've mainly been substance abuse prevention, being able to look at those overlapping risk factors with suicide prevention and problem gambling and other behavior problems. I have a lot of coalitions that have started new task force or even new coalitions around suicide prevention. And so I'm really excited about that, and they are feeling more confident and more empowered so that they can look for financing and funding sources in order to support their work in those areas.
We are really proud that suicide prevention showed up in a big way at the conference in October. So there was breakout sessions for data collection for suicide prevention. Zero suicide was featured, which is something that Douglas County is implementing this coming spring. There were presentations about youth programs, and there were presentations on means reduction for suicide prevention as well. Something else that we're really excited about at headquarters is working with other state agencies and partners in drafting a new state suicide prevention plan. Something that's extra exciting about that is the community's willingness to partner with the KPC so that we can create a really data-informed plan for the future. We were also able to share with Prevention Works participants just some different evidence-based strategies for suicide prevention, specifically within schools and working with youth. That was something that had been highly requested, was to talk about evidence-based practices, so that was also really fun and exciting to be able to share with the participants there.
We get to read all of the accomplishments that are happening across the state of Kansas and then feed that back in a way that's beneficial to everybody. So we have story data, and then we have numeric data that supports funding opportunities. And then we just wanted to share a few numbers with you because we're the evaluation team. So we have 226 hours that we use from our center to support the community checkbox, and that's been since 2017. And then since 2019, we have 16 KPC grantees and 10 PFS grantees that we noticed the need to provide more training and more TA so that we're getting the type of data and that they're comfortable entering that data and receiving the information back. So we're very proud to be able to support them in that way. And then last, I'll just use the last number, we have like 4,588 prevention accomplishments in the CCB that are in support of prevention in the state of Kansas. So thanks very much.
In the past year, we've seen a lot of different opportunities for us to grow and to be more adaptive as the state of Kansas adapts and the prevention infrastructure adapts in general. And so we're really excited about what the future years will look like for the Kansas Prevention Collaborative. And we're glad to be a part of it and to be able to tell the story of the other Kansas Prevention Collaborative partners and the great work that they're doing.